Fatty liver. Fatty liver symptoms, grade, causes, complications. Fatty liver disease, also known as hepatic steatosis, is a condition where excess fat accumulates in the liver cells. It can be categorized into two main types: alcoholic fatty liver disease, AFLD, and non-alcoholic fatty liver disease, NAFLD. Here's an overview of fatty liver, including symptoms, grades, causes, and potential complications. Symptoms. 1. Asymptomatic, early stages. Fatty liver often has no symptoms in its early stages, and many people discover it incidentally during medical tests for other reasons. 2. Fatigue. Some individuals may experience unexplained fatigue or weakness. 3. Right upper abdominal pain. In some cases, there may be discomfort or a dull ache in the upper right side of the abdomen. 4. Enlarged liver. The liver may become enlarged, leading to a feeling of fullness or discomfort in the upper abdomen. 5. Jaundice, rare, in severe cases or due to complications, yellowing of the skin and eyes, jaundice, may occur. Grades of fatty liver. Fatty liver disease is graded based on the severity of fat accumulation and inflammation in the liver. 1. Grade 1, mild fatty liver with minimal or no inflammation. 2. Grade 2, moderate fatty liver with inflammation. 3. Grade 3, severe fatty liver with inflammation. 4. Grade 4, advanced fatty liver with inflammation and potential scarring, fibrosis, or cirrhosis. Causes. 1. Alcohol consumption. Alcoholic fatty liver disease, AFLD, is primarily caused by excessive alcohol consumption. 2. Non-alcoholic factors. Non-alcoholic fatty liver disease, NAFLD, can be caused by several factors, including obesity. Excess body fat, especially around the abdomen, is a significant risk factor. Insulin resistance. Conditions like type 2 diabetes or metabolic syndrome can contribute. High cholesterol and triglycerides. Elevated blood lipids may increase the risk. Rapid weight loss. Sudden and significant weight loss can trigger NAFLD. Certain medications. Some medications can contribute to fatty liver. Genetics. Genetic factors can influence susceptibility. Complications. 1. Non-alcoholic steatohepatitis, NASH. In some cases, NAFLD can progress to NASH, a more severe form characterized by liver inflammation and damage. 2. Cirrhosis. Severe NAFLD or NASH can lead to cirrhosis, which is scarring of the liver tissue. 2. Cirrhosis can result in liver failure. 3. Liver cancer. People with advanced fatty liver disease have an increased risk of developing liver cancer. 4. Cardiovascular disease. NAFLD is associated with an increased risk of heart disease and other cardiovascular complications. 5. Type 2 diabetes. Fatty liver and insulin resistance often go hand in hand, increasing the risk of type 2 diabetes. It's crucial to diagnose and manage fatty liver disease early to prevent its progression and complications. Lifestyle changes, such as a healthy diet, weight management, regular exercise, and alcohol moderation, can help improve liver health. If you suspect you have fatty liver or are at risk, consult a healthcare professional for proper evaluation and guidance.